I'm Sarah. I'm your nurse. I can see that your doctor has prescribed for you to start taking Lasix. I can see also that you were recently diagnosed with heart failure. Do you have any questions before we begin? Okay. Well, okay, so the drug that he's prescribed to you is Lasix, and he's prescribing it because of your heart failure due to the edema that comes with that. So right now, because of your heart failure, your heart is unable to pump blood effectively. And so Lasix is going to work by increasing your sodium or it's going to remove sodium and water from your blood, and then that sodium and water will be excreted in your urine. And so this is going to decrease your blood volume and make your heart pump more effectively and reduce that swelling and water that's built up around your lungs because of the heart failure. So let me give you some education on how to take this medication. So you're going to take this by mouth once daily, and it's 20 milligrams. Okay, you can take this with food or milk. It's going to decrease any stomach upset that may come with it. And if you have trouble swallowing at all, you are able to crush these, or you can crush these pills if you need to. So another recommendation is probably to take this in the morning, because it's going to make you have to go to the bathroom a lot. Some other things is it can make you have low blood pressure. So try to change positions slowly instead of, getting up from a chair really fast or anything like that. And if you could report any unusual weight gain, probably more than 3 pounds in a day. And some other things we want you to report immediately are if you have muscle weakness, cramps, nausea, dizziness, and any numbness or tingling in your extremities, and hearing loss. And also, this medication sometimes can cause a bad rash for Stevens-Johnson syndrome, so we want you to report any kind of rash that you have after you start taking this. And I also saw that you have type 1 diabetes, correct?
Mm-hmm.
Okay, and how many times a day do you usually monitor your blood sugar?
4, before meals and then once at bedtime.
Okay, we want you to continue doing that. Monitor your blood sugar closely because Lasix can increase your blood sugar. There's also some interactions that it has with certain drugs. So are you taking any kind of nitrates or anything for high blood pressure?
Mm-mm.
Okay. How about digoxin?
No.
Lithium?
No.
Okay. Do you currently take any antibiotics?
Mm-mm.
Okay. Well, if while you're on this treatment and you, for some reason, start taking an antibiotic, make sure and let your provider know, because it can have an interaction with a classification of antibiotics, aminoglycosides to be specific.
No.
So, do you take any aspirin or any kind of anti-inflammatory right now?
Not that I know of.
Okay. Well, if you start taking any of those regularly, that's another thing you might want to report to us or your provider, because it may decrease the effectiveness of Lasix. So I have this handout here for you to take home with you, and remember to report any of those signs.
Okay.
I'm just going to make sure and test your understanding. So what time of the day should you take this medication?
In the morning.
Okay, because it's going to make you have to go to the bathroom a lot, so you don't have to get up in the middle of the night. And how many times should you check your blood sugar every day?
The same that I've been doing.
Okay.
Before meals and at bedtime.
Okay, good job. And remember that you can take it with food or milk if you need to upset any kind of, or prevent any GI upset.
Okay.
So, sounds like you understand. Well, let us know if you have any questions about your medication.
Thanks.